Welcome to Medical Marijuana and Wellness. Today's topic is exploring edibles and understanding the routes of administration. Joining me today is Amy Green from MMTC. Welcome, Amy.
Hey, always great to be here, Marc.
Edibles are a fun subject. It's a great product. It's a great route of administration. And the big issue is, or big question, I should say, is what's a route of administration, right?
Absolutely. Yeah. So when we start talking about what is a route of administration, we're talking about how are people actually taking in the cannabis products. And there are a lot of different ways that this can happen. So obviously you have smoking cannabis that everybody's very familiar with. That would be the inhalation route. You also, though, have topical products like balms or creams. But then you have oral products that can be sublingual tinctures that go under your tongue, that can be edibles, and that can be products like RSO. So there's a lot of different products that patients could use, and there's a lot of different routes of administration, and it always comes down to what the patient is comfortable with.
Right. I mean, route of administration is how you take it. That's what that really means. And you hit the nail on the head. The real question is, what are you comfortable with? And that's if you're comfortable taking it, you'll take it. And if you're not, it may not be something that you build into your daily routine, which is really what you want with a cannabis regime. So let's talk a little bit about cannabis itself. So tell me about the components of cannabis, because this is important when it comes to understanding edibles.
Absolutely. So cannabis generally is going to be made up of three different components. You're going to have the cannabinoids. Those are the substances that we're very familiar with, your THC and your CBD, for example. And then you have terpenes. Now, terpenes are naturally occurring compounds that contribute smell and taste to the cannabis plant. And then you have flavonoids, very similar to terpenes. They're also going to bring in color and flavor, but they're also going to change the taste of the cannabis plant as well.
Now, it's interesting that when you take a look at those being put together, that creates something called the entourage effect.
Yes, so the entourage effect is when you have your cannabinoids, terpenes, and flavonoids all working together to provide really powerful benefits to the patient.
And this is really important because it's important to understand that by putting those together, what you're doing is in essence, you're boosting the medical efficacy of cannabis itself. And that's what's really key when you're looking for relief using cannabis as a alternative. Now, when we talk about edibles, we're really talking about the oral route of administration, right?
Correct. Yes. Generally, anything that you put into your mouth, that can be capsules, that can be edibles, that could be a tincture. There's a lot of different ways that you can use edible products, but the biggest thing is you're putting it in your mouth, you're going to swallow it, and it's going to travel through your stomach and your gut.
Yeah. And one of the keys is it says 30 minutes to 2 hours. Sometimes it can take 3 hours to work. That's one of the keys. We'll talk a little bit more about that. But the nice part about the oral route of administration is it lasts between 4 to 10 hours. So, for example, if you want to get some sleep, taking an edible just about an hour or two before you go to bed will help you sleep through the night, as opposed to a sublingual or a topical that will wear off very quickly. Let's talk a little bit about what edibles are. So let's define them. These, unfortunately or fortunately, are very tasty and very good products. We have a number of different edibles. Tell me a little bit about the different alternatives that we have.
Certainly. So the most common one that a lot of people are probably familiar with is the gummies or the chews. Those are going to be usually a gelatin-based product. Generally, in the state of Florida, they will be clear, as the state doesn't allow any colors in our products. Then you have products like chocolates. Chocolates can be a really great edible. And the big part of that is chocolate is fatty. Cannabis loves fat. THC loves fat. So it's a great vehicle for the THC. Lozenges, also a really great product. The nice thing about a lozenge is you're going to hold it in your mouth until it dissolves. And so you're actually getting some sublingual absorption, meaning under the tongue right away. So lozenges can sometimes have a faster onset time than some other edibles. But again, you still want to aim, you're still going to think about that hour and a half to 2 hour range to feel the full effects.
It's better to err on the side of caution when it comes to using edibles.
Certainly.
And people tend to make teas out of them, for example.
They do, yeah. So there are patients that make cannabis teas. That could be with either THC containing flower or it could be with CBD flower, just
Mhm.
depending on the patient's preference. Then you also have lots of baked goods. So obviously, cannabis brownies, the cookies, all of the different baked goods that are possible with THC. Then you have companies now that are producing powders that you can add to a beverage. These are really neat because it's very specific dosing to however much you put into the beverage. And then, of course, you can always add different products to food, something like RSO, distillate syringe, or the infused oil. You can be added to food or to drinks.
Mhm.
It works with both.
Yeah, I think cannabis-based smoothies are actually becoming very popular right now.
They are, yes.
So let's talk a little bit about what they all have in common, because in this case, all of them have, your THC, your CBD, plus all your other cannabinoids, right?
Correct. Yeah. So we're really looking for, again, that entourage effect. We want to look for the most complete product that we can that's going to contain the cannabinoids, the flavonoids, and the terpenes.
And then also, I think it's important to point out, cannabis loves fat.
Absolutely. Yeah. Cannabis is lipophilic. That means that it loves fat. And so any product with fat is a really great transportation vehicle to take that THC through your system.
Edibles aren't new. The edibles have been around for an awful long time. I mean, they found that as far back as 2,000 years ago, they started making a drink, which, by the way, is still made today in India.
Absolutely. So the interesting thing is, yeah, again, we are not the first ones to do cannabis infused drinks. It's just coming more mainstream now.
And then also, there's been again a history of the first cookbook for cannabis was actually produced in 1465, which I find very interesting. We think we've discovered this new product, but really it's been ingrained in the history of America for a long time. And for those of us that are senior citizens, we remember Alice B. Toklas, this famous song from the 60s. But the point is, you now have a product that has a lot of history to it. So let's talk about the pros and the cons of using edibles. Why would I use an edible, Amy?
Yeah, so the biggest thing is that they are extremely easy to dose and they have a really great absorption rate because it is going from your mouth to your stomach to your digestive tract. Your body has a long period in which it can digest that product, break it down, and absorb it. So you have a really high absorption rate with edible products. Generally, edible products are going to take longer to take effect, but again, they're going to last a lot longer than, say, an inhaled product like a vape.
It's an important point because a lot of people who are looking at using cannabis to get sleep, if you use a tincture drop, for example, which will last between 4 to 6 hours, if you take it before bed, you may wake up at 3 or 4 in the morning because it wore off. Where if you use an edible, it'll last and help you through the night to maintain the sleep that you're looking for.
Yeah, absolutely. And edibles are really just a great alternative to smoking, vaping, or other forms of cannabis that might be a little bit overwhelming or intimidating to newer patients.
Now, why wouldn't I use it? What do I have to be careful of when I use it?
Certainly. So the biggest thing to keep in mind of when you're using edibles is they take a long time to take effect. Just like you always say, it's about that time that you feel like it's not working and you take another, that it starts working. And then you end up at an uncomfortable level because you've now taken too much. So it's really making sure that you are very patient in making sure that that dose is effective for you before you take any more.
I always tell people looking at edibles, just you got to be cool. When you take one, wait 2, maybe 3 hours to find out if it's working. Because what you don't want to do is really take too many.
It's take the dose that you want to take and then put the product away. I generally recommend to patients, especially if they're buying infused chocolate bars, to stop at a gas station, grocery store, pick up a non-infused chocolate bar, like your regular Hershey's bar, to have something to snack on that is not that won't medicate you more. That way you're dealing with the craving while also not putting yourself into an uncomfortable position.
So let's talk about how it's ingested, because really the key to why it takes so long and how effective edibles are is because they're absorbed through the blood barrier lining in your mouth. Tell me a little bit about this.
So generally, you're going to have the majority of your absorption with edibles, not necessarily in the stomach, but in the small intestine.
Mhm.
And it has a lot of small intestine to traverse through, and it's going to be absorbed the entire length there. So as long as the patient has a normally functioning gut, we generally expect that it's going to take 1.5 to 2 hours to feel the full effects. But again, it's with a normally functioning gut.
When your body does absorb it, it really turns into 11-hydroxy THC, which is actually better for you than Delta 9, but it's something that lasts for, let's say, up to 10 hours, right?
Yeah, so 11-hydroxy THC, it's our liver actually converts THC into. So it goes from THC into our liver, comes out as 11-hydroxy THC, and the 11-hydroxy THC, it lasts a little bit longer, but it's also a little bit more sedating than just regular THC. So that is why it can be really, really helpful for helping you get to sleep, but also stay asleep.
And when they talk about microdosing during the day, what they're talking about doing is taking a very, like if you have that chocolate bar, taking just a square and then maybe breaking that square into maybe 4 or 5 little pieces, taking it, and then of course an hour or two and they kick in, that little bit is working during the day rather than taking, that whole square of chocolate.
And with microdosing, there's a significant chance that you won't feel the effects that you would normally feel at a higher dose, but it's still providing you with medication throughout your body.
Right. So for example, pain relief, you'll get the pain relief, but you won't get the high. That's what the key is all about. Let's talk a little bit, you were talking a little bit about how it gets absorbed into your body. This is a little bit of a complex slide, but I think what it's really showing is how it's metabolized in your body.
Correct. Yeah. So on the left side, you've got THCA. So that is the acidic form of THC. That's actually what's mostly present in the cannabis plant, is that acidic form of THC. And then when you apply heat to it, THCA becomes THC. Now, in this example, they've rolled it into a joint and they're smoking it, which is certainly an effective way to convert your THCA to THC. However, the effects are extremely quick and they don't last as long. Part of that is because the THC is being absorbed directly into the bloodstream via your lungs, and it's not being processed through the liver before it goes into your bloodstream. So with inhalation products, you have that very quick, sometimes it could be heady feeling, and that's because you're getting that dose of THC that has not been metabolized into 11-hydroxy THC.
But when you put it into your body, when you actually put it into your stomach, this is where your liver actually metabolizes it and turns it into 11-hydroxy THC, right?
Correct. Yeah. And so when we are ingesting a product, we've swallowed it, it's going through our stomach and our gut. From our gut, it's actually going directly into our liver before it goes into the bloodstream. And so our liver is going to make that conversion and then push out the 11-hydroxy THC, which again, 11-hydroxy THC, a little bit more sedating. It lasts a little bit longer than regular THC. And so those are part of the reason why you see such a difference between inhaled products and oral or edibles.
And you mentioned sedating is one option or one characteristic. I think another characteristic is the fact that it helps relieve pain.
Certainly, yeah. And because it does last so long, it can be really beneficial.
The nice part about edibles are that you really maintain a lot of the terpene profile, because when you're making edible, you're not going above the heat range to be able to burn off these terpenes. Tell me a little bit about terpenes.
Yeah, so again, terpenes are what's going to give cannabis its smell and its taste. And so really a very beneficial part of the cannabis plant, because they're also what is providing a lot of the medical benefits, such as being anti-inflammatory and analgesic, which is a pain reliever. They can also be antifungal, antibacterial. They can help with stress and anxiety. And the really interesting thing about terpenes is that each specific terpene is naturally occurring in this cannabis plant, but every plant is going to be a little bit different. So your terpene profile from plant to plant might change. But when you know what's in a specific plant and what specific terpenes are in it, you can kind of know, like, for example, limonene. I know that limonene is going to be a little bit more mood elevating and it's going to help relieve some stress. And so I know that products with limonene are going to help with my anxiety, but they're also going to be a powerful anti-inflammatory. So I know I like personally products that have a lot of limonene because I'm looking for those effects.
Sure. And I think it's important to point out that when you go to a dispensary to buy the product, you can ask the dispensary for what they call a certificate of analysis, referred to as a COA, and that COA will tell you the terpenes that are in the product that you're buying. So Amy, these are some of the characteristics that each of the terpenes have with respect to addressing various conditions.
Yeah, and the really cool thing is, like, I can look at a specific terpene, take, for example, limonene again, and I know that it's going to provide anti-inflammatory effects. It's going to elevate my mood. It's going to help relieve stress and anxiety. And that's just one of many things it's doing. But I also know that there's other terpenes that are also going to help with those same things. So for let's look at elevates mood. So we've also got the linalool and the terpenoline. So I could expect a product that has limonene and linalool in it to help elevate my mood if that's something that I'm looking for.
Sure. And again, consulting that certificate of analysis, that COA, will help to determine which terpene is there, which actually translates then into the benefit that you're going to get from using that particular product. A couple of well-known cannabinoids that are out there, although there are 200 cannabinoids in cannabis, two of them are very famous, THC and CBD.
THC, this is what people think about when they think about the cannabis plant, and it can also be found in hemp plants, but only in concentrations of less than 0.3%. THC is the psychoactive part of the plant, and this is a little bit outside of this webinar, but it does target the CB1 receptor in the brain and the central nervous system, and the CB1 receptors tend to be located mainly in the brain, the central nervous system, and then down the spine.
Hence why you get the psychoactive effect from them.
Correct, yes. CBD. Now, CBD is found in the cannabis plant as well, but it's also found in the hemp plant. Nice thing about CBD, it is not psychoactive, so it's not going to give you that stoned, heady feeling, which can be really great when you're looking for something for daytime use. And it's mostly going to be targeting the CB2 receptors, which are generally in your peripheral organs and your immune system.
Right. And I think that's important because what this really helps with a lot with is inflammation. I mean, THC is known for helping with pain. CBD is known for helping with inflammation. And if you have any pain-related issues, using a product that has both of those will help be able to not only relieve it, but also stay in a mode where you actually are in what I call a normal or close to normal mode. So, Amy, when it comes to edibles, we have a couple of options. We can actually purchase them or make them. Tell me the differences between them.
Yeah, absolutely. So the really nice thing about purchasing edibles from a dispensary is that you know what you're getting and they tend to be very consistent. Now, we know that dispensaries are lab testing their products before they reach the consumer. And with that lab test, the COA or certificate of analysis, we're going to be able to see the THC content, the CBD content, minor cannabinoids, the terpene profile, and we're going to know exactly specifically what is in our product. The dispensary edibles make it just very easy to dose and it's very easy to access. You just go into a dispensary, ask for a product that is going to meet your needs, whether that is something for the daytime, something to sleep, but you're going to have so many choices at a dispensary.
Yeah,
Now,
and I should point out that many dispensaries will say that their terpene or their edibles don't have any terpenes in them, but I know of dispensaries that do have terpenes in their edibles, and they may cost a little bit more. I think you're going to talk a little bit about cost in a second, but I think the reason that you're paying a little bit more is because you're getting more. Those terpenes are critical to being able to help you get the relief you're looking for.
yeah, certainly. And you're totally right. Not all edibles have terpenes in them. And so the ones that do are really providing a more whole plant or a more complete product. Because it's containing the terpenes, the flavonoids, the cannabinoids all together, which is that big part of the entourage effect. And just like you said, the cost can vary widely. So you might have a product that is just THC only without any of the terpenes. That might be down in the $10 to $15 range. Or you might have like a very high-end product that has all of the terpenes, flavonoids, cannabinoids. And that product, I mean, you might be looking at $25 to $30 for a pack of edibles. It's just going to vary wide.
Yeah, and what I do with those is I typically wait till they go on sale and then buy them because terpene edibles last up to 6 months. Tell me about making edibles. I know a lot of people do. I do, and it really provides a lot of relief and gives you something that you have control over the product and the results that you're looking for.
Absolutely. When you're making your own edibles at home, I mean, you are controlling the entire cooking process. So you know exactly what's in your edibles, how much product you added, if you have any food sensitivities. Those are all things that you can tailor your edibles around. And then there's several different ways to make edibles, and there's a lot of different products that you can use as well. Now, for the best results, we really always recommend just using a professional recipe. Those are generally going to be tested many times over and provide really consistent results. And then we also recommend using just really high quality ingredients, whether that is whole flour, it can be a distillate syringe, but you also want to make sure that you have a high quality oil as well.
Sure.
Generally, when you are making edibles at home, you are going to be infusing that oil with the cannabis. So having a high quality oil to go along with your high quality cannabis, super important. And then one of the biggest things is because you're mixing it in with your fat, you really want to make sure that when you are mixing the batter for your cookies, brownies, chocolates, whatever you're making, you want to make sure that you're mixing it very well to ensure that the cannabis is well distributed throughout your product.
I think that's one of the reasons why you recommend using a distillate cartridge rather than flour when you're making edibles.
Absolutely. So when you're using a distillate syringe, you know exactly how many milligrams of THC are in that product. Take, for example, you buy a distillate syringe that has 800 milligrams of THC, and say I use half of that syringe in the brownies that I'm making. Now I know then that I have 400 milligrams of THC, and when I cut my brownies, I'm just going to, however many brownies I produced, divide that into 400, and you have really good idea about the dosage of each product.
Sure.
That being said, distillate syringes are very strong, and so you'd really want to pay attention to how strong you're making your edibles. Of course, for newer patients, we would always recommend starting at a very low dose and gradually working your way up to a dose that's effective for you.
Yeah, and I think a lot of people make edibles not only because they're in control, but also because they're very cost effective.
Absolutely.
Let's talk a little bit about the recipes. I know I don't want to get into each individual ones, but and these are ones that have been tried and true and tested. So I think here's a good guide for if you want to head into the area of making your own. Now, let's talk about when you do want to use flour. Tell me a little bit about that.
Yeah, so decarboxylation is the process of converting THCA, or the acidic form of THC, into THC. This is done by applying heat to the product. In the same way that lighting a joint converts THCA into THC, we are going to activate that THC by actually baking the flour at a pretty low temperature. It's usually about 40 to 45 minutes, and you're baking it at like 120 degrees, pretty much as low as your oven will go. And all you're doing is you're just converting that from an inactive form of THC to the active. However many brownies I produced,
Flour without being decarboxylated, but when you do, you actually trigger the THC and CBD, where without it, you're just using THCA and CBDA, which, by the way, are still extremely effective cannabinoids to help you with pain and with inflammation. So, Amy, there's some tips on using edibles. Why don't you take us through a few of these? One of them starting with shopping at a legitimate dispensary to know the product that you're buying.
absolutely. When you go to a state licensed dispensary, that's where you're going to get products that have that COA, or certificate of analysis. And that COA is going to tell you very specifically what's in your product, including the THC, CBD amount, but also terpenes, flavonoids, minor cannabinoids. You're going to know exactly what's in your product. A nice thing about a state licensed dispensary product as well is the dosing is going to be very standardized. So you'll know that one gummy is going to be this much, one block of chocolate is going to be this much. It tends to be a lot more consistent than what you might make at home.
And that's really, really key, because what you want to do is you want to know how much product you're taking, both THC and CBD, and the packaging will help you determine that.
Certainly. Yeah. The other thing is we always want you to just eat beforehand and make sure you're staying really hydrated while you're using the product. Eating beforehand might slow down absorption a little bit, but it would make it more comfortable for you, just because you're not going to have that instant munchies as soon as it kicks in. So it can be a little bit better in that way. Another thing is I really just recommend clearing a couple hours in your schedule, set aside a space in your home. When you're using a product for the first time, you just want to make sure that your set and your setting are very intentional. So you're intentionally not doing anything. You're not going out playing golf or pickleball. You're not, you're not paying bills or doing anything important right then. You're just setting aside time so that you know how you're going to feel when you're using that product.
Sure. And you're recommending also looking at using really 2.5 or 5 milligrams of product, which I think is really, really key, because most of the products, like especially the chocolate bars, are set with 10 milligram squares, right?
Correct. Yeah. In the state of Florida, at least, our products tend to be pretty standardized at 10 milligrams per dose. So in order to get to that 2.5 milligram, you know that you'd be either cutting or breaking apart a piece of edible to get to that 2.5. And this is exactly where using a product like a gummy can be very, very helpful. They're incredibly easy to cut with just a butter knife, and you know that you're going to get pretty equal pieces all the way around when you're using a product like that.
Yeah. And it's important to start low and go slow when it comes to edibles, because one of the biggest problems people have is they don't wait the 2 hours. The product either tastes too good or they lose patience. And again, I go back to my famous saying, about the time you don't think it's working and you take more is about the time it starts working.
Absolutely. And that is 100% true. You do need to be very patient with edibles, give them time to work. And that 2 hour mark is kind of the minimum that you want to wait before you take another.
And actually, cannabis is not dangerous. Chemically, it's not dangerous, but it can make you uncomfortable. It can give you some side effects that you're not comfortable with.
Certainly, yeah. So you're 100% correct. There is zero chance of overdose with any cannabis product, but there is a chance that you're going to get past your area of comfort and you're going to start experiencing those negative side effects, that kind of stoned, heady feeling, feeling very unfocused, unmotivated, kind of like you're couch locked or locked into the couch. High doses of products, you'll start seeing those negative side effects.
Right. And one of the other things that you can do, which is really helpful, is actually have some pure CBD products, have a tincture. And if you're beginning to feel uncomfortable, take some CBD product, because what that'll do is it'll counteract the THC and really bring you back down and bring you back to where you want to be. And then also, resting and drinking fluids help.
Absolutely. And the CBD products are super important, especially if you ever feel like you took too much THC. The stoned, heady feeling that you might experience, it probably won't completely go away, but it will be lowered significantly to the point where you're a lot more comfortable, at least with the experience.
Sure. I think that's important. That's an important part of using cannabis. You talk a little bit about dosing, because really dosing is one of the keys to being successful with medical cannabis. This is the start low and go slow.
Absolutely. The biggest thing with medical cannabis is we want to find the minimum dose possible to give you the effects that you're looking for without unwanted side effects. So what we usually recommend for patients is to start at a very low dose, which would probably be a sub-therapeutic dose. So it's not your sweet spot yet. And then slowly increasing or titrating your dose up to the point where you have that relief that you're looking for and you don't have the negative side effects.
Right. And this is where you take your, for example, you take your gummy and you cut it maybe not in half, but also potentially even in quarters.
Correct. Yeah. So say that first day you start with that quarter of an edible, you take that, you wait 2 hours and you're not feeling anything from it. You could either wait till the next day to take another dose, or at that 2 hour mark, you could take another quarter. But the thing is, though, the next time that you take a full dose, probably the next day, you know that you could start at a half, because you know a quarter is ineffective for you. And so you're just slowly increasing your dose to find that spot where you're comfortable. So I always tell patients the changes in your dose need to be very slow, because if you make a big jump, say from a quarter of an edible to a full edible, I mean, that's a really big jump, and there's a lot greater chance that you're going to go past the zone where you're comfortable, past that target sweet spot, and you're going to go into the uncomfortable range.
And really the key to this is listen to your body. People always ask me, well, how much should I take? I can't tell you that. Like caffeine and like alcohol, every person's body is different. I mean, I have friends who have one drink and they're done for the night, and I have other friends that drink the whole bottle and they're just getting started. Cannabis is the same way. It just has to do with how your body reacts to it. And that's why starting low and going slow is really, really important. And your body will tell you when you begin to feel relief. I know that when I was dosing, because I have herniated discs in my neck, I could feel the relief. I could feel the pain going away. I could feel my motion coming back. When I continued to increase the dosage, I began to get to an area where I was a little bit uncomfortable. I didn't feel right. I felt I was getting a little euphoric. And so what I wanted to do next time is I went and I went back to that where I was yesterday, to know exactly where I want to be, which is where my therapeutic dose is.
Absolutely. And the best thing to know is that you can increase or decrease your dose. You just want to make those changes slowly over time, but you can absolutely back your dose down as well to bring it back into that sweet spot.
And the key is you're in control. That's one of the benefits of using medical cannabis is you're in control. When you say go low and go slow, we're really talking about really using milliliters and milligrams. And let's just spend a moment. I don't want to get too technical, but I think we need to understand the difference between them.
Absolutely. So liquids are generally going to be measured in milliliters, which are a liquid measurement, and milliliters is a thousandth of a liter. So it's a very small amount. When you have products like an edible, they tend to be measured in milligrams, which are more of a weight measurement. And so a milligram is a thousandth of a gram. So again, a very small amount. Now, when we are looking at knowing your sensitivity to THC and CBD, if it's a liquid product, we'd want you to start with, 2.5 to 5 milligrams of THC. That may be a different concentration based on the product that you're using. So if you do decide to start with a liquid product like a tincture that would go under your tongue, I really recommend talking to the person that's selling it to you and learning more about the concentration of the product so that you can get a very exact starting dose. With something like an edible, you definitely always want to start at a very small dose. So we usually recommend patients start in that 2 to 2.5 milligram range. That's about a quarter of an edible. This is a dose that is subtherapeutic for most people, but for some patients, that's exactly where they need to be. So by starting there, we're capturing those patients that is their effective dose. And then patients that it's not effective for, they can slowly increase it to find that effective dose.
Sure. And I should point out that when you're using a gummy, you can take the gummy and cut it in half or into quarters. If you're using a chocolate bar, you'll see on the chocolate bars, they are divided into squares. The square itself will probably be 10 milligrams. So you can actually cut that into halves and quarters as well. Again, pay attention to the amount of THC because that's where you want to be able to understand what your therapeutic dosing level is. So Amy, we've talked a lot about edibles. We've talked about dosing and more importantly, the different components to make up a successful regime using an edible. I think the main message I'd like to leave folks is when you're looking at using edibles, just be cool. Take your time. It may take an hour or two to work, but you'll get great benefits from it if you do that. And if you try to eat these things like Skittles, you could run into some issues that you really don't want to play with.
Absolutely. And again, start low, go slow. You can always take more. You can't take less than what you've already taken.
Well, listen, I want to thank everybody for watching this video. If you're on YouTube, please like and subscribe. We appreciate that. And more importantly, if you're looking at us from the Marijuana Aware webinars, please join us. We not only have a webinar here on edibles, but also on a number of different subjects that are out there. And our YouTube library is a great resource to help you understand products and how to use them that can help you get the relief you're looking for. I thank you very much for joining us. And again, check out our social media